heel pain for Achilles tendonitis, or pain in the back of your heel, okay, or pain in the ankle joint, whatever. So these are the questions. So the question is related to the 5 component of the ankylosis spondylitis. Then the maneuvers of the examination, which is simple. It looks like 10 maneuvers, but they are simple. So there is 10 maneuvers, there are 3 tests, there is 3 things to examine. The 10 maneuvers are simple. Ask the patient to put his chin on the right shoulder. Ask him to put the chin on the left shoulder. Ask him to let the chin touch the chest, then let him look up. So it's like you're asking him by his chin to move in the 4 directions, okay? Don't try to do it by yourself. Don't try to move his neck by your hands. Never do that, because the patient will say, this is very dangerous. You may injure his spinal cord. So just ask him to do that. If he said, I can't, or he did it very slow, that we are done and we have a positive result. Then let him put his ear on the right shoulder, his left ear on the left shoulder. Okay, so this you make a different movement of the neck. So it is the chin in 4 directions, then the ear right and left. Then let him do lateral flexion. Lateral flexion means the patient will try to get his fingers below his knee. So this is called lateral flexion on both sides. Then let him to flex ventral to the front. Let him do dorsal tilt, go by his body to the back. And let him do waist twist. The waist twist by doing like putting his hands on the waist and try. It's like dancing right and left. You can't do that very fast. It will not take any time. Just tell him the orders very fast. Can you please give him 4 orders together? Can you please put the knee, the chin on the right and the left and up and down? Can you please put your ear on the right and ear on the left? Then can you please touch? Can you please flex to this side, flex to this side? Can you lean forward? Can you tilt back? Then can you do that? Just show him example. He will do the same as what you are saying. If you don't have time, just do some of these. You don't need to do all that. Just do some of these. Then 3 tests. Chest expansion. Ask for the measuring tab. Okay, and you will put it under the armpit of the patient and make the cross of the measuring tab over the sternum and check. Maybe let's say it will be 20 inches, for example. Let him take a deep breath. It should move, okay, for 2.5 to 5 inches. With this patient, they don't have enough chest expansion. So usually you will find the expansion less than 1. Usually it's less than 2.5, but usually you will not even notice any expansion or any measurable expansion. The other thing is the patient to move and stop beside the wall. Okay, if we consider this is the wall, just a second. If we consider this is the wall, okay, you see, let him put his heels just touching the wall, and this is the back. You see the distance between his occiput and the wall. It should be more than 5. For them, it will be more than 5. Usually you can, if you do that yourself, you can't touch the wall. You can touch it, or it will be close by 2.5 or 5 centimeters. This will be more than 5. Can be this looks more than 20 or 15 or something. Okay. Then the shoulder test that's done in the back. So just watch that in the YouTube how to do the shoulder test. We do it in the back. We put marks. We put the tab. We let the patient lean forward. It's modified shoulder that's done now. But usually when you ask to do it, they will tell you no need. But you need to watch it just in case if they agree that you do it. Just watch it. You don't need to do all that in the short case. Okay, but at least offer. If you're going to do that, and watch it please on the chat box. Sorry, on the YouTube. Okay. Occiput to wall test. Let the patient stand. Dr. Adam asking me. You will stand to the wall and you will put your heels to the wall. Then we will check the distance between your occiput, the back of your head to the wall. Usually, if you do that yourself, you will find that your head can touch the wall. But for these patients, okay, their occiput will be super far from the wall. It will be more than 5 inches. That's it. And these are called the occiput heel wall test. The chest expansion, as we said, and the shoulder. Just watch it on the YouTube and offer to do it on the shoulder. Then you will go and examine the chest by auscultate the chest for the fibrosis. Or you will study that when you start the respiratory. There will be fine crepitation, not changing in character with coughing. So this is for the lung fibrosis. The heart, you will try to look for murmurs of mitral valve prolapse for aortic regurg. So usually aortic regurg will give you a diastolic murmur, okay, in the left lower sternal edge, okay, more with expiration. You will know that by heart when you take your clinical course in clinical cases. Then the lower limb, you will look for Achilles tendonitis and tenderness and pain. Okay, so this page you will try it. You will try to utilize the time again. Without practicing, this means nothing. So you need to practice that. Then investigations, you will do labs including kidney function, ESR, CRP. This basic labs including the kidney functions, ESR, CRP, HLA, human leukocyte antigen, B27. Then imaging, X-ray, echo, CT, chest. Okay, then treatment, physical therapy, NSAIDs, DMARDs, biologic. Remember, now I'm considering you pro, so I don't need to say that there is non-pharmacological and pharmacological, and you will include the team, you will include the joints doctor, you will include the lung doctor, you will include the heart doctor based on what's the patient condition. Don't forget the occupational, don't forget DVLA. Okay, you'll not tell such patient and go on inform DVLA. You just advise him to quit driving. Okay, because the problem that when they move their neck, they can injury. If they move their neck, they're very slow. They can't see the sides of the road, and sometimes if they excessively move their neck, they can cause injury for their spinal cords. Okay, so give me the okay that you're okay with the ankylosis. Then I will go back and show you how Dr. Abdullah knew that this is ankylosis. Give me the okay in the chat box. Don't worry, by the end of our course, you will prefer to have dermatology case, although I know you have some fear of dermatology. Inshallah, after we are done, you will say, I hope all the exam will be dermatology. So we will go now to the back pain. Okay, and this is what I like in Dr. Abdullah performance. Okay, that he asked a very important question. I think you received this algorithm, so he followed the algorithm, and this is perfect. I like when if it is your first time to practice, just take the algorithm in your hand and ask from that. No problem. I mean, you don't need to know it by heart. You need to practice how to follow the algorithm first, then you will start to study it. It's like you're reading from a book, then you start to keep it by heart. So for the back pain, you ask its rates. So you ask it, the severity, the size of the pain, exactly, it's in the upper part or lower part. Is it onset, gradual, or sudden? Course, increasing, decreasing, radiating anywhere, any association, timing, morning, night. Okay, what increase it, what decrease it? Okay, I would like Dr. Abdullah ask it in this case if it is increasing with effort or improving. Okay, with movement, I mean. Then severity, it is 1 to 10, not 0 to 10, Dr. Abdullah. So you can say 1 to 10 if 1 is the least and 10 is the maximum. Then ask neurological signs and symptoms. Very important to ask about numbness, weakness, pins and needles. I mean, weakness in the lower limbs make the back pain emergency. Okay, weakness in the back pain make it emergency. The other thing, the urine and back passage control, very important. So if you have a patient with back pain with food drop, it's an emergency. If you have a patient with loss of control of the urine and back passage, it's an emergency. Okay, so you need to run. These questions very important, and it will impress the examiner. Believe me, not everyone will be able to ask these questions. So if you ask this question, the examiner will feel how competent you are. So any stiffness, very early, ask about stiffness, and having stiffness usually for the new doctors, it gives us the difference between the inflammatory and mechanical. For the difference between inflammatory and mechanical pain, whether it is back pain, whether it is joints, any joints pain. If you attend my free lecture I did before the course for the joints pain, you remember that the question is any stiffness, does it improve with activity? So this is how to ask the question. If the pain improve with the activity, so this is going with the inflammatory. This is very important. Okay, this is very important. So any stiffness, does it improve with activity? If the answers are yes, so this is going with inflammatory back pain. Okay, just wait, doctor. There's a doctor. I don't know your name, but you are in a hurry. Just wait, and I will tell you why we will ask these symptoms of the red flags on the other side. So the first thing you need to know after the secrets and after the neurological symptoms and the urine and back passage, this is called the yellow question. Just make it yellow. Okay, then if the answers are yes for the inflammatory, you will proceed in our blue pizza. So remember the blue pizza because we will mention it many times during today and tomorrow. Okay, so we will ask once it is inflammatory back pain, we will go to the blue pizza. Remember, usually for any back pain or joints pain, you need to ask PND 3S dash. So PND, the P for the pain, the N for the number of the affected joints, the D for deformities. Okay, so usually, as I said, write the PND, the P for the pain, the N for the number of the joints, the D for the deformities. Okay, and remember that 3 S's are swelling, symmetrical, and stiffness. So remember, this rash refers to everything. So this rash is not with only the PND, the rash. In case of the rheumatology, very early ask about rash. So remember, PND 3S rash is super important, and you need to ask. Never go out in case of rheumatology without asking rashes. Okay. So you ask the patient if he has any other joints pain, and if he has any deformity, and what the number of the affected joints, and the criteria of the pain in the other joints, if there is any. Then I will ask about if the pain in the joints is symmetrical on both sides, if there is any swelling, if there is any stiffness in these joints. Then I'll ask in general about rash. Okay. Remember, when there is any deformity in rheumatology, you need to ask deformity means check if it is correctable. So for any deformity, you need to check if it is correctable or not. Can you correct it or not? Because this makes differentiation between the arthropathy of systemic lupus and the arthropathy or the deformity of the rheumatoid arthritis, which is not correctable. Okay, so right there for the D, for the deformity, ask correctable or not. For the rash, tell him show me. So the rash, show me. So whenever I told you there's a rash, don't wait till you see the rash. Once you said there's a rash, can I take a look? Because maybe you will look and you will simply find it is psoriasis. So if you look at the rash early and it is psoriasis, no need to waste time. Just proceed as psoriasis, right? So how to ask about the blue pizza? How to ask about it? Okay, I will go to ask first about the back pain. Okay, is it associated with any problem in the eye? Red eye, pain in the eye for enteropathy. So the question of ankylosis, shortness of breath, awareness of heartbeat. Okay, frothy bends another weight loss for amyloidosis. Then pain in the back of the heel for the Achilles tendonitis. Then I'll ask about psoriasis. Okay, I'll ask about skin rash and nail change. So this is screening. Remember, psoriasis is very important in this case. Why? Why psoriasis is very important in this case? Answer me in the chat box. Why it is very important in this case to exclude the skin rash and the nail change? Why? Anyone have any answer to give me in the chat box? No, doctor, I think this is not why it is very important. Not because of the hyperuricemia. Usually hyperuricemia will not be a cause of back pain, it will be a cause of gouty arthritis more. Yes, I agree, Dr. Fauzi. Because the yes, I agree, Dr. Madonna. Because there is a picture called ankylosis form. There is ankylosis like psoriasis. So the patient, you may say, hey, I'm done. This is ankylosis, and I'm very happy because you will not find all the 5 A's. Please don't think if this is a recent ankylosis. This patient has ankylosis since 10 years. But if a patient newly diagnosed with ankylosis, you will not find all these A's. Maybe only back pain with stiffness. So again, don't say Dr. Tan told us there should be 5 A's. No, sometimes there is nothing of these. These are complication and association of ankylosis. But initially, it is nothing. Only the back pain and the appearance of the X-ray. Okay. So this is what's called psoriatic spondyloarthropathy. I agree, Dr. Jim. Okay, so that's why if there is a psoriasis, it gives you the same picture, the same symptom, not identical, but at least it will give you a picture of ankylosis. So you may be very confident and give a diagnosis of ankylosis, and then the examiner will tell you, did you not see any rash with the patient? You'll tell him, I'm sorry, I didn't ask. Then you go and look behind the patient's ears and on his scalp and hairline, you will find psoriasis, then you will be shocked. So remember, once you reach ankylosis, don't stop. When it is ankylosis, ask about nail change and skin rash. Okay, and that's why you need to ask it very early here. And whenever you ask about psoriasis, remember gout. So things related together. Whenever ankylosis, ask psoriasis. Whenever psoriasis, ask gout. Because psoriasis is inflammatory, okay, seronegative, and it can cause mechanical pain by the presence of gout. Because psoriasis is associated with hyperuricemia. Okay. Then the third part of the pizza is the basic disease. How to ask? Now you know how to ask. Basic disease, you ask by mouth sores, by sores in private area after saying sorry for this private question, joints pain, previous history of blood clot. Then reactive arthritis, and it is very important to ask about if the joints pain related to infection, preceded by infection. And remember, it is not about current infection because this is a common mistake all the candidates doing. They ask if do you have any fever, do you have any infection? It shouldn't be that way. The patient doesn't have any pain now. He doesn't have any serious infection now, but he had one just 1 month before starting the symptoms, which may be 1 year ago. Maybe the patient has the pain started 1 year ago, but the important point is the infection just before starting the symptoms. I mean, the patient since 12 months, he has the pain, but since 13 months, he has a severe UTI. He has a severe gastroenteritis, after which he starts to have this joint pain and stiffness that increasing over the year. So when you ask if you have any infection, this is not enough because it's about the current condition, and this is not what we are looking for. Then the last thing is the enteropathy. Okay, so you need to ask about the loss motion. You need to ask about blood coming with the back passage, any history of abdominal surgeries. Okay, so this is what's called enteropathic arthropathy. So it is inflammatory bowel or celiac disease or any problem in the GI system, autoimmune associated with joints problems. So enteropathy. So this is called the the seronegative, okay, causes of the back pain, and you will use it in the back pain, the hand pain, and any joints pain. Remember, this is called the blue pizza. Okay. Then on the left side, if the answers for the back pain, there is no stiffness, and here I want to highlight as usual. Sometimes the patients can differentiate or can recognize the meaning of stiffness, because sometimes the pain itself is considered stiffness. Sometimes they consider it stiffness. They said, yes, I have my knee is stiff. He thinks that this is stiffness. So let me give you a vague answer for that. So I mean, don't you all the time consider it will be a classic case coming identical as we are describing now. So you need to have many factors to build in. So I will build on stiffness. I will build on the relation to activity and rest. The patient with ankylosis suffering when he go home and try to sleep. When he extend on the bed, he said the pain increase. When he sit for a long time, he feel the pain increase. When he move, going and coming, he forget the pain, and the pain a little bit improve. Okay, this is what's happening. So that's why I'm telling you, don't base only on the stiffness. Sometimes patients with osteoarthritis, they will tell you I have knee stiffness, and this is not, it shouldn't be stiffness because this is mechanical pain. Osteoarthritis is mechanical pain, not inflammatory. But if you ask him, he will tell you, yes, I prefer to rest. With rest, it is relief. With any activity, the pain increase. So this is a factor besides examining the patient. Okay, so don't base only on the stiffness, because sometimes the patient can't answer the question of stiffness in the right way. So if there is no stiffness, and if the pain gets worse with any activity, with any movement, and the other things going negative or positive, whatever, but you found that these two elements are negative, then I will go to what's called my green pizza. And this is the mechanical pain. And remember the word top. Remember top. Okay? Top here is the T for trauma and TB and tumors. TB is not only TB, I mean TB and infections. TB and infections. Okay? So the first T for trauma. Okay? The first T for TB and infections, like brucella. The third T for tumors. Can be tumors. This is the answer for the doctor asking about that. So it is a mechanical pain, when there is neurological symptoms. Okay, signs and symptoms. We will go to the mechanical directly, and we will ask about bundle one, and it could be, or they will answer my question about tumors and about TB and other infections. If I ask about the TB, I ask about coughing out of blood. I asking about shortness of breath. I'm asking about weight loss, night sweats. Okay, lumps and bumps. I ask about exposure to a sick patient. Okay, then brucella. I'm asking about unpasteurized milk and cheese or dairy product. Right. Tumor. I will ask bundle one again. Then they all refer to osteoporosis. And with osteoporosis, just to make it simple, usually I'm sending you a list for osteoporosis. Okay, just remind me to send it. Okay, for the osteoporosis, you need to ask if this is associated with weight gain or weight loss, because there's many causes of osteoporosis. There's many causes of osteoporosis. Okay, for the cases, you need to know that patient after menopause will have osteoporosis. Patient with primary hyperparathyroidism may have osteoporosis. Patient with previous spinal fractures are. It's good I remember. Dr. Abdullah, don't say vertebra to the patient, call it spine. Call it spines. Okay, for you in your spine. Okay. So osteoporosis again. So postmenopausal primary hyperpara. Patient with the history of radiation therapy, patient who's very thin, okay, with weight loss, remember, patient with weight loss and osteoporosis, remember, hyperthyroidism, patient with hyperthyroidism, okay, they have osteoporosis, patient with weight gain, patient on steroids, patient with Cushing syndrome, patient with acromegaly, they are all have weight gain and osteoporosis. So three things. For osteoporosis, ask about if the patient have weight gain or weight loss. If there's weight loss, confirm osteoporosis, confirm hyperthyroidism, because it can be the cause of osteoporosis. Patient with malnutrition will have osteoporosis and weight loss as well. Patient with gaining weight with Cushing, taking steroids, taking radiation therapy, patient with acromegaly, they will gain weight and they will have osteoporosis. Then the P refer to Paget's disease. Yeah, and osteoporosis also ask about the diet and ask about sun exposure. So remember, you need to ask about the weight in osteoporosis, sun exposure, diet, the patient with malnutrition, yes, as I told you, patient taking steroids, patient taking thyroxine. Then the last thing, Paget's disease, and it came in the exam before, Paget's disease. Okay, and in Paget's disease, I want you to write these points I'm talking about. If you missed it, you will not find it, so just write it, please. The patient will have increase in skull diameter in Paget's disease. And it is in disease, so there will be interlaped nerves. So the patient may have problem in hearing problem because of the nerve trapping. There will be also frequent fractures, history of frequent fractures. Okay, there could be also heart failure. You may have heart failure. This patient should have bone scan. Okay, they will find that the bone metabolism is very high, and in the blood works, the alkaline phosphatase will be very high with normal parathyroid hormone. So again, just to make it simple, the skull diameter will be increased. There will be hearing problem. There will be history of frequent fracture. This is the history, and then maybe heart failure, orthopnea, lower limb swelling, shortness of breath, and we'll do bone scan to notice that increased bone metabolism. Then how to treat the patient with Paget's disease? Anyone have any idea? Write in the chat box. Anyone have any idea? Yes, exactly. Bisphosphonate. You are very good in this parts in investigation and treatment. That's why I'm telling you, don't spend a lot of time. It's about the approach. You may lose this exam because of the approach and time management, not the knowledge. You need to organize your knowledge. You all have perfect knowledge after the MRCP 1 and 2. It's about how to organize and utilize it. So the bisphosphonate, I agree. How to examine this patient? How to examine the patient with Paget's disease? You will examine the head circumference. Ask the patient if he has changed in the size of his hat, if he wear any hat. Examine the heart. Okay. You will check scar for previous fractures. The heart, you may found heart failure. Any signs of heart failure? The hands, because as you said, there is entrapment of the nerves, so there can be carpal tunnel syndrome. So you need to ask about two things in the nerves problem, the hearing problem with the carpal tunnel problems, because of the median nerve. Okay. Then the fundus, you need to examine the eye, the fundus. Okay. Osteoarthritis. Optic atrophy. There could be optic atrophy, and also angiod streak, something called angiod streak. I will show you in pseudodensoma, angiod streak. Okay, and there could be kidney stones as well, kidney stones. So just write these details so you can study the Paget's. This is the details. Okay, so as I told you, you need to skull diameter, heart, frequent fracture. When you examine the patient, will be the head, the heart, the scars for fracture, the hand for carpal tunnel, the fundus for optic atrophy, and ask about any kidney stones history or red urine or flank pain. Okay, doctors, give me the okay that you're okay with the back pain. So again, I will give you the example now. Simply, this is a patient coming with back pain. Can you tell me more about this back pain? The site, acute, chronic, increasing, decreasing, radiating. What increase it? What decrease it? Do you have any weakness, any food drop, any numbness in your lower limbs? Do you have any problem controlling your urine or back passage? Can you tell me if there's any stiffness? Okay, mainly in the morning. How long it extends, this stiffness? Did you notice that this pain improving with the activity and the stiffness improving with the activity? Okay, do you have any pain? Do you have any rash? Do you have any pain in other joints? If yes, what is the number of these joints? In your hand? Yes. Any deformities? Yes. Is it correctable deformities? Can I see? Okay. Then, is there any swelling? Is it symmetrical in both sides? And you have swelling as well, stiffness as well in these joints that causing pain? Then the answer is going with the inflammatory. I will go to this circle as I asked it. About the 5 A's, about the rash and the nail change, about the sores area and the genital and oral sores, then about the history of infection. Remember, for reactive arthritis, there is what's called Reiter syndrome, which is can't pee, can't see, can't climb the tree. So there can be eye problem, can't see, can't pee. There is a urination problem. Okay, can't climb the tree, there's joints problem. So these are the 3 components of Reiter syndrome. Then enteropathy asked about lost motion, blood, tummy pain, and abdominal surgeries. Then if the answers of these are no, I will go to sir, do you have any history of trauma? Okay, to your back. Do you have any weight loss? Nihilist weight, scarf, coughing out blood, exposed to a sick chest patient. Okay, what about do you drink unpasteurized dairy products and cheese, like cheese and milk? Okay, especially the people coming from areas of the country areas. Okay, then tumors. I would ask about any weight loss, lumps and bumps with bundle 1 as well. You gain any weight? Do you lose any weight? Say, can I ask you about your cycle? This is the female from the goose. Okay, do you take any medicine called steroids? Okay, if you gain weight, confirm if it's crushing or not. Okay, do you put more weight? Where exactly? In your tummy. Do you have any stretch marks in your tummy? If you take steroids, do you take any protection for your bone with the steroids? No. So you need to help you in that. Back pain for patient with is on steroids for sarcoidosis came in the previous 2 nights. Patient coming with a back pain. Okay, and behind that the patient has sarcoidosis for which she is taking a large dose of steroids. Okay, silly case, but again, you'll just go through the mechanical. Okay, for the back pain, it will go with the osteoporosis. You'll find she's taking steroids, and she had a shortness of breath as well, and this is because of the sarcoidosis. And she had rash because of the sarcoidosis. So you'll catch it. If you have the idea, you can catch it, but you need the approach. Then the back disease, did you notice any change, any previous fractures, any change in your hearing, any change in your hat size? So that you ask the questions that you need to ask about our story. Okay, that's it. Are you okay with that? Okay, I hope you found that helpful. The most important part that I want to feel that you're feeling that you are building the confidence. Okay. How to explain badges for the patient? You will tell him that you have a condition at which there is abnormal, okay, action happen in your bone that make it more weak. Okay, there will be abnormal growth of your bone that cause compression on the nerves, is causing these symptoms, and at the same time there will be a weak areas in your bone, so there will be abnormal or unbalanced growth of your bones, okay, that causing these symptoms, and start to describe it: fracture because of the weak areas, and entrapment of the nerves because of the extra bone growth. We are going to give you some medication that acting by take the calcium from this and put here, and that's it. So remember that when you want to describe any disease, okay, make it simple. You can use a term and describe it. Use the term and describe it. Okay. So let's see who's the next doctor. We have Dr. Fauzi done, Dr. Fatima done, Dr. Abdullah done. So we need Dr. Shazia. Dr. Shazia. Usually the second one is lucky because the second one will practice after we discuss the algorithm. So you can use it. Dr. Shazia, open your mic. How are you? Hello? Dr. Shazia, try to say anything. Hello, hello. Can you take the case or you want to skip? Hello? Dr. Shazia, we can't hear you. Hello? Okay, so it looks that the mic of Dr. Shazia is not working. She asked for 1 minute, please. Okay. You'll try to look out and look in again? I don't know, Dr. Islam. Let's see if Dr. Shazia will solve the problem. Just 1 minute to give some rest for my vocal cords. After this case, we'll take some break, then we will continue. Dr. Shazia, are we okay now? So the next player, if Dr. Shazia is not ready, will be Dr. Adham. Dr. Adham 2010. So Dr. Shazia, you may take the next case till you fix the problem of the mic because we don't want to waste your time. So I'll open the mic to Dr. Adham. Whenever you solve the problem, Dr. Shazia, whenever you solve your mic problem, you can take the case, okay? Take another case. Thank you. Dr. Shazia said I'm ready. Okay, so just say anything. Say hello.
No.
No, this is Dr. Adham. Dr. Shazia, can you say anything? You said I'm ready, but we can't hear your voice. There's a problem in your mic. You are ready, but your mic is not ready. Hello. Okay, so Dr. Shazia, try to solve this problem. We'll move to Dr. Adham, then you can take the next case. Try to look out and then look in again. Dr. Adham.
Yes, Dr. Adham.
How are you?
I'm fine, boss.
You feel sleepy?
No, we are here.
Okay. So let's go to your case. Okay. So this is Dr. Adham case, and this is a history taking, and this is Mrs. Maria Gonzalez, and she is 72 years old. I didn't open your. Give me a second. Okay. So. Okay. This is Maria Gonzalez, and she is 72 years old. Okay, and thank you for seeing Mrs. Maria, who gives a 2 weeks history of severe back pain. She lives on her own and is struggling to cope at home. She's known to have osteoporosis, and her family doctor is concerned that she may have had another vertebral fracture. Okay, this is her vitals. Your task is to interview the patient and based on the history, obtain construct differential diagnosis and plan for investigation. You should explain this to the patient and answer any question they may have. Do not examine the patient.
Okay.
You need 2 minutes or you can start.
Better 2 minutes, I will.
Okay, take 2 minutes. Can we start, doctor?
Okay, good then. How are you?
How are you, doctor?
I'm Dr. Adham, one of the doctors here in the clinic. I want to ask some question. You are Mrs. Maria Gonzalez?
Yes.
And you are 72 years old?
Yes, doctor.
Mrs. Gonzalez, I get some letter from your GP that he's telling that you have a severe back pains and it's making your life is very bad nowadays, and previously you have a diagnosis of osteoporosis. Can you tell me more in your own words about the severe back pain?
Yes, doctor. I had this back pain since 2 to 3 weeks, and actually become very severe. I'm used to have a back pain. I'm used to have that. Okay, but the problem is this time it become very severe. And before I had that, because they told me I have a weak bone. Okay, and I have a fracture before. And when I have this pain now, I'm very worried because it's get more severe and it's increasing in the severity of time.
I'm sorry to hear about this, Mrs. Gonzalez. But can you tell me exactly where is the site of this pain in your back?
It is in the middle of my back.
In the middle of your back. And when this started, how did it start? It started gradually or it started suddenly like this?
As I told you, doctor, I have a pain since years, but the pain in the last 2 weeks, I would say it is increasing every day.
I'm sorry to hear about this. But you tell me this for years, and this time is different from the previous type of back pain?
Yes, doctor, I feel that yes, it's different, and it is severe and fastly growing. It's a little bit in the severity of the fracture.
It is just okay. You want to tell me something? You can talk.
Yeah, it was about, as I told you, I had the severe pain before, which has happened with the fracture, and then after that, all the time I have some back pain. But the problem recently is that this pain, which is increasing massively in the last 2 or 3 weeks.
I'm very sorry to hear about this. Is it going to any other side from the middle of your back?
It's mainly in the middle of my back. Doctor.
Okay, and this back pain, and do you take anything that relief for this back pain?
Anything to relieve it? Yeah, I tried to take ibuprofen, doctor. It helps for 1 hour, then the pain come back again.
And is there a specific time for this pain that coming as you in the night or in the day?
It's all the day, doctor.
I'm sorry, but if I give you a score from 1 to 10, how much you are putting this?
I would say 8, doctor.
And Ms. Maria, do you have any other site or joint involvement causing pain in your hands, your legs?
Usually, doctor, I have pain everywhere in my body because, as I told you, I have a weak bone. So usually, I have a pain in my hands, I have in my feet, in my legs. Okay, but I can't tolerate all that pain, and I'm taking my medicine for the weak bone. But the problem is that this pain is different, doctor. It's very severe. Hello?
For your weak bones.
Yes, well, I didn't hear your question. Again, please.
What's the medicine that you are taking for your weak bones?
Yes, I'm taking what's called alendronate, doctor.
Okay, and I want to ask you also more about this pain. If there is any deformity with in this part or other part, you see?
Yeah, I don't have deformities in my head.
Did you notice any near the mirror? Did you notice any swelling or something?
No, doctor.
Is there any stiffness, Mrs. Gonzalez?
Stiffness? No, doctor.
No stiffness. Okay. Mrs. Gonzalez, do you have any history of fever?
Fever? You mean
yes.
high body
temperature? Yes.
I think, doctor, in the last days I have fever. Yes, because I start to feel shivering recently at night with excessive sweating many times. Not only in the night, sometimes in the morning. And I'm taking ibuprofen and it helps.
And this fever coming to as a night, this high temperature?
Night and morning.
Did you check it before?
What do you mean by before?
You checked it during this temperature at home. You checked the temperature.
Yes, it was 38.5, and one time it was 39. Do
you have any history of cough?
Cough, no, doctor.
And no cough of blood. No cough of blood.
No cough of blood.
Do you have any lumps or bumps?
No, doctor.
Do you have any history of trauma to your back?
Trauma to my back? No, doctor.
And did you notice any weight loss?
Weight loss, not really, doctor.
Okay. And did you have any hearing problem?
Hearing problem, no, doctor.
And you told me that you have a history of this fracture,
yes.
Right?
Yes.
Oh, well, this fracture, when it happened before?
The fracture happened years ago, doctor.
Okay. Mrs. Gonzalez, do you have any skin rash? You told me.
Skin rash, no, doctor.
Do you have any mouth sores?
Mouth sores, no, doctor.
Do you have any difficult swallowing?
No, doctor.
Do you have any weather preference?
No, doctor.
Do you have any abnormal hair growth?
No.
I'll ask you something. What about your cycle? I think you're 72 now.
No cycle, doctor. I'm 72. It's stopped already since 20 years.
Okay, Mrs. Gonzalez. And do you have any past medical history of what I can know, Mrs. Gonzalez?
I have diabetes, doctor. I have diabetes for which I should take insulin, but actually I keep forgetting the dose.
Okay. Any other? What about your diabetes control?
They did not control, doctor. My last A1C was 9.
This is and do you have any medical illnesses other diabetes?
I have
osteoporosis. You are taking any medication?
Yes, I'm taking Losartan 80.
Is it well controlled?
Yes.
Okay, but we need also to inform you that it's better to also control your diabetes, and that's you are doing with your high blood pressure. This will be helpful. Mrs. Gonzalez, what's the impact of this problem in your life?
I'm very worried, doctor, about what's going on. It's not about 2 weeks. I can't help myself. I am someone who's living alone. I totally depend on myself in doing my daily things. So this back pain, I can't even prepare my food. I can't clean my house. Everything is very tough while I have this back pain.
Really sorry to hear about this, but here we and the team are also here to help you to solve this issue. And do you I'll ask you some? There's some history of similar condition like you?
No, doctor.
And I'll ask you some private question. Do you what is about you? You are doing what do you do for a living?
I'm retired, doctor.
Okay, and you are driving or not?
Driving, no, doctor.
Are you drinking alcohol?
No, doctor.
And are you smoking?
No, doctor.
You are taking any other medication that you can tell me about?
No, doctor. That's all.
Okay. Mrs. Gonzalez, can you tell me is there any recent previously in this week's any history of throwing up?
Throwing up, no, doctor. But I feel sick. I feel sick most of the time in the last week.
And there is any loose motion?
Loose motion?
Yes.
No, doctor.
You have any contact with sick person?
No, doctor.
And you are taking any bus the milk pasteurized or non-pasteurized?
No, doctor. I don't drink milk.
Okay. Do you have any eye pain?
Eye pain? No, doctor.
Any heart racing?
Heart racing sometime when I have high blood temperature.
And do you have any short-term rest?
No, doctor. That's because of the pain.
Do you have any stored in private area? Sorry to ask you this question, but I think it may help.
No, doctor.
Do you have a history of blood clots?
No.
And do you have previous history, Mrs. Gonzalez, of feeling sick for previous months or previous 1 month or previous years that maybe I know about?
Feeling sick, no, doctor. Just the feeling sick is recent that I'm feeling these days.
And did you, during the last things, did you do any investigation or see a doctor?
Yes, I seen a doctor. I seen a surgeon in the last month, and because I injured my finger, and because I injured my finger while work cleaning my garden, and he gave me medication for the wound, and he mixed some dressing. But the problem that when I started to take this medication, this antibiotics, it started to cause lost motion, and it was very painful for my tummy. Then I stopped it, and I decided to clean the wound myself.
I'm really sorry to hear about this.
Yeah.
And did you get better after taking this medicine?
I didn't take it. I take it one time only. Then I stopped it. He gave me antibiotic called Augmentin, and I didn't take it. I took it only one dose. Then I didn't like to continue, and I'm cleaning the wound myself.
Okay, I'm really. I'm going to ask you more questions. If you have any previous history of passing black stools, black motions, from your pregnancy, do you notice any black motions?
No.
Do you have any previous surgery?
No.
Surgery means.
No.
And after you stop this medication, that's what you give you. Did you feel better or no?
I feel better regarding the lost motion, but my finger started to hurt me a lot, and it became very painful and swelling. I tried to bring some things from the pharmacy and try to make the dressing myself. 2 minutes remaining, doctor. I start to clean it myself, and actually it's not bad now. Not perfect, but it's not bad now.
Okay, so sorry to hear about this. Did you, Mr. Gunal, do you have any concerns regarding your health?
Yes, doctor. I want to know what's going on. What's going on? Why my back hurt? Is it a fracture, doctor? Is it a new fracture?
Sorry, Mr. Gonzalez. We can put this fracture in our possibilities, but this will be in the bottom or in the middle of our differential regarding your case. Most probably this case related to your previous diagnosis, what your doctor is saying you have osteoporosis. Another thing is can be also due to this recent history of infection, and that this manifestation due to this one, and you are not taking full proper treatment. Also can be about can be.
You mean my finger causing my back to hurt? This is weird.
Yes, I mean like this because sometimes these facts from here can go to the side of your what is called your spine specific side. So when they are settled there, they will grow in the numbers. They will go like this way. And regarding this here, me and the team were here to help you by doing some blood tests. I will do some imaging for your back, and we will consult the different team that can help you regarding this condition. And all here we are here to solve the problem. I answered your concern.
Just write for me some medicine. I want to take it and leave. Then I will follow with them again.
Sorry, Ms. Gonzalez, but we need till we will confirm what exactly the diagnosis. We need to keep you here with us. And we need
time.
Okay, thank you.
Thank you very much, Dr. Adham. It is score time. Examiners, give Dr. Adham score. Dr. Madonna gave you the full mark. Then she changed her mind. No, she gave you the full mark 28. Then she remembered that it is 20 because station 2. So then she gave you 20. That's it. She is insisting for the full mark. Okay. Okay. Some give you 18. Some give you 16. Some give you 14. We have a very tough examiner. Alhamdulillah, you are not examiners. He did his job actually. Dr. Adam, you did your job.
But I forget some specific things. Very fatal.
Okay. So what if you repeat it? What are the things you are going to ask about?
Actually, I wrote my alarm sign, but I forget to ask about all the alarm sign. Ask about all of it. That's the most important here.
Yes. So now questions. What's your differential diagnosis, though?
From the history of this 72-year lady, and that she came with back pain, severe back pain, and she has previous history of infection to the wound. Can be mechanical. It can be here due to discitis, one of the possibilities, and others. It can be a part of her previous disease osteoporosis, has causing fracture.
Fracture. Yes.
And,
what are you going to do for this patient?
Actually, we should fully examine this patient, and we'll do a routine lab in the form of CBC, looking for which white cell count. And,
what's the most important thing to do?
Well, ESR, CRP, and plain X-ray of the back. And for osteoporosis, also we need to do bone scan for this patient. MRI, so I also can help.
That's it. So I need to hear MRI very early and blood culture. Okay.
Yes, and CBC plus blood culture.
So MRI should be done, right?
Yes, MRI scan should be done.
You admit this patient or let her go?
Actually, we'll admit till certain diagnosis.
This is a very serious condition, right?
Yes. For IV antibiotic and
seconds. Sometimes in the patient in hours during the consultation, after the consultation, 1 or 2 hours, the patients become with weak limb or become with dropped foot because you don't know at what time the infection will increase or the inflammation will increase, and it can compress the cord, right?
Yes.
So you should admit the patient. You didn't ask the diagnosis. You didn't ask the neurological symptom, the control of the urine and stool.
Yeah, I write in my paper, but I forget to pass them all.
That's why it should be on the top. Here, I agree with Dr. Muzar al-Islam. Here, the osteomyelitis. You will put in the difference. So the idea would be the relation between the back pain and the infection. That's why I didn't discuss that part of the algorithm here. I tried to skip that in order not to give you the key of the case. But when you have this algorithm, you see down there what I wrote. Look to this algorithm, the back pain. TB for infection, including brucella and discitis. Ask recent infection with incomplete antibiotic.
Yes.
This case came before, and this case is written in the examples of the MRCP UK. You'll find it number 3 or 4, I think. So this is the case. I just copy and pasted. Okay. So this is how the case is coming. So if you know the approach, it's not only about knowing the wound, it's about going to check it's inflammatory or mechanical. So don't you think that you feel a little bit more organized when you follow the algorithm?
Yes, of course.
Although the answer is not obvious here, but at least you know where you are going. It's back pain, so I know what I'm going to ask, right? And this is exactly my objective. I want you all to know what we are going to do with the case. Whatever we will find inside, I want you to have your route, you know? So exactly, cold compression here is very important. I mean, the neurological symptoms. So remember, neurological signs and symptoms and the incontinence is super important in any back pain. Yes, I agree with you. You will put the infection, discitis, osteomyelitis on the top, okay, of the signs. Remember that simply in this case, you see patient is 38. Please, when there is vital signs, don't skip it because you just
right.
What?
She's febrile, yes.
That's why I'm telling you that having the fever. And in the case of the pulmonary embolism, the patient heart rate is 110, right?
Yes.
So the
Really
vital
good.
signs they are giving you for a reason. So I want you, when you have a vital signs, to take care of that, because there could be, most of the time, there will be something significant to catch. Okay?
Okay.
Okay, great. So the doctor asking for multiple myeloma, this will be part of tumors, doctor. So there will be parts of tumors. So when you found that, the answers for the tumors, okay, and it is going with malignancy, you will say that it could be malignancy. So the T, you remember tumor, TB, okay, because the tumor could be metastasis, could be multiple myeloma. So multiple myeloma itself is part of tumor. So you will look for the bundle 1, and you will ask about the symptoms of hypercalcemia, which is present with any cancer. Okay?
Okay.
Remember, multiple myeloma should be considered, yes, in any old age patient coming with back pain, okay, and it is part of the T in our algorithm. So when you found that it's going with tumor, you can include it with it, okay? So that's it. It's the break time. Okay, how long you want the break?
But how much I score? Because I missed this one.
No, you're not bad. You will get. It is not. He will catch it. You may lose 2 marks. Okay, because you know what? You decided admission. No, Dr. Islam. No. It's a different thing. So for you, Dr. Adham,
Yeah.
You decide to admit the patient. I just need you to organize your answer. So MRI should be early here, blood culture should be early here. Okay, and you will admit the patient. So you will save doctor. Always remember, you want to decide if you are safe doctor or not. So admitting the patient, doing MRI, including the team, you take care of the structure of the case, you reach the correct diagnosis. So don't be hard for yourself. I will give you in this case 18. If the examiner is a nice one, we'll give you 20. Remember, the difficult cases with a quiz is the most simple one. You know why, Dr. Adham?
Mm-hmm.
Because sometimes when you solve the quiz, they give you the full mark. Because there is something hidden there. You catch it there. I like very much your question about when was the last time you see a doctor. This is very important. I didn't like your analysis to the diabetes. Diabetes need more care when it is there. So if I reach the diagnosis early and patient has diabetes, I will go through the details of the complication of diabetes. And you will learn in this course how to go through any case of diabetes. But not in this case if you didn't reach the diagnosis yet. So I would like if you dig deeper in the diabetes. But here, having uncontrolled diabetes increase the possibility of infection and unhealed wound, right?
Yes.
So this was the cause of disseminated infection from the hand going to cause osteomyelitis or cystitis. Okay, and the neurological symptoms, you are going to admit the patient. Very important, but not when you reach the diagnosis. When you catch the trick, you miss something, you'll take about 18. If a good examiner, he may give you the 20. Okay, because eventually you dealt with the patient as an emergency.
Okay.
Okay, again, based on the patient, the examiner role, that's not bad. You did very well, actually.